Imagine a disease that has, for as long as anyone could treat it, only ever been fought one symptom at a time. You are exhausted, so here is something for the sleepiness. Your muscles give out when you laugh, so here is something else for that. Two problems, two separate patches, and never once a medicine aimed at the actual thing underneath them both. That was narcolepsy type 1 until last week. On August 5th, the FDA approved a drug called ORZEYFUL, and it is the first one ever cleared to treat this disease at its root instead of chasing its symptoms around. I'm Naomi, and this is the Good News Desk. And tonight, the good news is about a door that just opened for about 120,000 Americans. So let me explain what the root actually is, because it is a beautiful piece of biology. Deep in your brain, there is a signal called orexin. Its whole job is to keep you awake and to hold a clean line between being asleep and being awake. In narcolepsy type 1, the cells that make orexin are lost, and once that signal goes quiet, the wall between sleep and waking starts to crumble. That is where the two big symptoms come from: the overwhelming daytime sleepiness and cataplexy, where a sudden rush of emotion makes your muscles simply let go. Now here's what makes this drug different. Every earlier treatment worked downstream, softening one symptom or the other. ORZEYFUL works upstream. It is what scientists call an orexin receptor 2 agonist, which is a technical way of saying it walks up to the exact switch the disease turned off and turns it back on. It does not muffle the alarm. It repairs the wiring. And this is not a hope or a lab result on a mouse, crew. It cleared the FDA on the strength of 2 full phase 3 trials in actual patients, with 2 lovely names, FirstLight and RadiantLight. In those studies, the company reported, quote, statistically significant improvements across the full range of symptoms of the disease. And that phrase, the full range, is the whole point. Not just the sleepiness, not just the cataplexy, the daytime alertness, the muscle collapse, and people's day-to-day quality of life, all moving in the right direction at once from a single medicine. I will be straight with you on one limit. The announcement did not hand us the exact numbers, how big those improvements were, so we cannot yet tell you it is a certain amount better. But the direction is clear and it is verified. And for the roughly 120,000 Americans living with this, a treatment aimed at the whole disease is something they have never had before. Now the honest size of this, in one breath, because good news earns trust by telling you the catch. Approved does not mean available. You cannot walk into a pharmacy tomorrow and fill this. Because ORZEYFUL affects the brain's wake system, it still has to go through a controlled substance scheduling review by the DEA, and that is expected to take about 90 days, which puts real availability somewhere around November, through specialty pharmacies, not your corner drugstore. And we do not yet know the price, which for a brand new first-in-class drug is a real question mark for the people who need it. So this is a milestone you can count on, not a prescription you can fill this afternoon. But the hard part, the part that takes years and usually fails, proving that a brand new kind of medicine works and is safe enough to approve, that part is done. So here's what I am keeping from this one. For decades, if you had narcolepsy type 1, medicine met you where your symptoms were and tried to quiet them, one by one, a life managed in patches. What changed last week is the target itself. For the first time, a drug goes after the missing signal that causes all of it. Takeda's chief executive, Julie Kim, put it this way, quote, the FDA approval of ORZEYFUL marks a new chapter for the narcolepsy type 1 community, as we introduce an entirely new class of medicine that will potentially redefine how this disease is managed and how people feel on treatment. I love a story like this, crew, because it is a reminder that some of the oldest, most stubborn problems are not permanent. Sometimes the science finally catches up, walks to the exact place the body went quiet, and turns the lights back on. For 120,000 people, that is not a small thing. That is the good news. I'm Naomi, and this is Pixel Politics.